Specialists in rehabilitation medicine not only treat and medically manage the complex patients with specialist knowledge, but also provide information, support, and counseling for the individual, family, friends, and carers. This helps them to understand the implications of the condition and maximize their functional abilities. We have a leadership role when it comes to managing the individual's care and improving the provision of neuro-rehabilitation services. We also have a teaching role to our team members and medical students.
We are responsible for reviewing and confirming the diagnosis and providing information around prognosis and recovery, medical and pharmacological management, management of sequelae including complex pain and epilepsy, overseeing care and liaising with other medical and surgical specialties if required, ensuring the safe discharge of patients and communicating with the GP for ongoing care.
Clinical neuropsychologists work with individuals, family, friends and carers to help them to adapt to or overcome their difficulties and better manage stressful situations. We help the individual's condition to be well understood and acknowledge changes that have occurred. Difficulties may be cognitive, including problems with memory or problem solving, emotional, including low mood or increased irritability, behavioural, including aggressive or impulsive behaviour out of character for the person. We may ask people to undertake tests to identify and understand their cognitive strengths and difficulties. We help the individual work towards their goals by providing education, psychological therapy, cognitive rehabilitation, or family support. We aim to improve quality of life for individuals by supporting them to regain their independence, return to work, and maintain positive relationships.
Ward managers manage the day-to-day running of the neuro-rehabilitation units, ensuring complex needs of patients are met. Staff nurses are involved in the direct patient care, including giving medications, taking neuro observations, meeting nutritional and bladder and bowel requirements. We communicate with patients and their families to offer support and guidance and work closely with support workers to meet the patient's personal hygiene needs. Specialist nurses have advanced skills in airway management and alternative feeding regimes. In the community, we help individuals to understand their neurological conditions, provide advice on medications, and monitor for health changes.
A speech and language therapist will see you in the neuro-rehabilitation setting if you are having difficulties with your swallowing or your communication. We may also be involved with working with the multidisciplinary team around the management and weaning of a tracheostomy.
Speech and language therapists provide individualised, in-depth assessment to look at communication, which may include speech production, language difficulties, and social communication problems. These difficulties may occur separately or alongside one another. Following this assessment, we may then provide direct one-to-one therapy, working with families and carers, therapy within groups, providing education. To help with communication, we may need to consider high-tech devices, for example iPads or eye gaze systems. There are also lower-tech alphabet charts to facilitate communication. We also help with communication around more formal decisions such as mental capacity assessments.
When working with swallowing difficulties, we may advise on optimal positioning, safe environment and bolus size alongside recommendations for fluids and diet which will enable a person to eat and drink while minimising the risk of aspiration or things going down the wrong way. We may provide exercises to rehabilitate a swallowing problem. We may carry out a more in-depth assessment, for example video fluoroscopy or FEES, which stands for Fibre Optic Endoscopic Evaluation of Swallowing. We may help to inform decisions around the need for alternative methods of feeding, and we may advise on mouth care for individuals that remain nil by mouth.
Dietitians help individuals to meet their nutritional needs and achieve their optimal nutritional status throughout their rehabilitation, taking into account any pre-existing nutritional requirements. We provide specialised diets and high energy and protein supplements to help meet nutritional needs orally for those who are at risk of malnutrition. We devise and monitor an individual enteral feeding regime for patients unable to swallow or needing additional nutritional support. We assess and review the environment and advise on management strategies to assist with behavioural changes impacting on oral intake. We conduct a dietary assessment and provide specific advice for those experiencing weight gain. And we work closely with the team, providing nutritional education and support and training as required.
Neuro-occupational therapists aim to improve a person's level of independence within meaningful daily activities. We clarify a person's baseline and social situation and then complete assessments to highlight any areas of difficulty and set realistic goals to address these. We can assess vision and then work on visual retraining, assess behaviour, then look at social interaction, education and building insight. We also assess sensory and physical abilities and manage posture, including splinting, and assess thinking skills and complete cognitive rehabilitation to support individuals with returning to domestic chores, employment and life roles. We can also identify obstacles and solutions in the home environment.
As neurophysiotherapists, we help individuals to learn how to manage physical difficulties and achieve the best quality of life possible by progressing or maintaining movement, strength, balance and function. We complete specialist neurological assessments to identify current needs and work with the patient to set realistic goals to guide their journey towards achieving their potential. Our specialist treatment programmes involve using hands-on techniques, assisting in respiratory management such as tracheostomy weaning, educating and contributing to the 24-hour management of posture and positioning through recommendations and progressions of specialist seating and equipment, and most importantly, educating and empowering patients, family and carers in the self-management of their condition.